My name is Jennifer Spakeen, and I'm the Director of the Aging and Disability Resource Center here with Eau Claire County. Thank you for taking the time to view our resource video. We hope it provides you the information that you're looking for. Our ADRC provides services to older adults and adults with disabilities that live in our county. We also help those caring for individuals that are older or living with a disability, and professionals as well. We provide unbiased information and assistance, so if after this video you feel like you could use more information, don't hesitate to give us a call. ADRC services are open to anybody that is an Eau Claire County resident. There is no income requirement at all for our services, so please don't hesitate to give us a call. We hope you enjoy the video. Thank you.
Hi, my name is Deb. In this section we're going to talk about health promotion and prevention programs. Stepping On is a fall prevention program for older adults. The program meets for 7 weeks, 2 hours each week. It is led by 2 facilitators and it is very interactive. There are no lectures, but there are guest presenters who come in on special topics. They include a physical therapist, a safety or police officer, optometrist, a pharmacist, and a registered dietitian. The topics include balance and strength exercises, the role vision plays in balance, how medications can contribute to falls, ways to stay safe when out and about in the community, what to look for in safe footwear, how to check your home for safety and eliminate hazards, what to do after falls, and more. Strong Bones is a strength and balance training program. Strong Bones meets 1 hour twice weekly for 10 weeks. It is led by a trained leader. Each class consists of 5 minutes of warm-up, 12 strength training exercises, 5 minutes of cool down, and nutrition education is also offered at classes. Living Well with Chronic Conditions is a self-management program for a number of different conditions. The Living Well program meets for 6 weeks, once weekly for about 2 to 2.5 hours. It is facilitated by 2 trained facilitators who have earned their credentials through licensing. It focuses on building skills and problem solving through self-management. The topics include dealing with frustration, fatigue, pain, and isolation that often comes with chronic conditions, exercising for strength, flexibility, and endurance, appropriate uses of medication, communicating effectively with your family, your friends, and healthcare professionals, evaluating new treatment options, healthy eating, and then the participants receive a complimentary copy of Living a Healthy Life with Chronic Conditions. Healthy Living with Diabetes is a self-management program for adults of all ages who have type 2 diabetes, pre-diabetes, or who live with somebody who has diabetes. The structure of this program, it meets for 2.5 hours once a week for 6 weeks. It is led by 2 trained facilitators. One of the individuals has diabetes or close connection to somebody with diabetes. The program works well with existing programs. The program really focuses on group problem-solving skills and not really focusing on an individual approach. There isn't individual medical advice, but rather there's more discussion time for daily living with diabetes, more problem-solving. There are some similar topics between a medical intervention program and this community-based program, but the approach is very different. It is peer-led education, which is very motivating. The team health in a medical model program, the health care team will prescribe what needs to be done, where this workshop really focuses on peer support on how to take care of your diabetes. And then there's an optional 7th session with a certified diabetes educator, which is a great opportunity for added questions. The topics in this program include techniques to deal with physical symptoms of diabetes, dealing with difficult emotions, appropriate exercise, meal planning for people with diabetes, appropriate use of medication, working more effectively with your healthcare professionals, and then you receive this copy of Living a Healthy Life with Chronic Conditions. Healthy Eating for Successful Living is a 6-week nutrition program. The program highlights incorporating heart and bone health choices, understanding the importance of physical activity at any level. It focuses on practicing incremental behavior change through goal setting and it uses self-management techniques to solve problems. This program meets weekly for 6 weeks, and they meet for about 2 to 2.5 hours. Again, it's a very interactive program facilitated by 2 trained leaders who have earned their credentials through a licensing training. And then it is supported by a registered dietitian who will answer questions from the group. Topics include the USDA's My Plate, label reading, portion size and exercise, grains, vegetables, fruits, water, and another exercise topic. Powerful Tools for Caregivers is a program geared for somebody caring for a loved one, and it will bring balance. It is evidence-based, similar to the Living Well and the Healthy Living with Diabetes workshops. This one focuses on the caregiver. Caregiving role is sort of like when an air flight attendant will say if the cabin pressure changes and the air max drop, be sure to put yours on first before you help the next person. It's sort of that way where to take on the role of caring for a loved one, it's important to care for yourself and know that there are resources available. This one, the evidence has shown that it improves the caregiver's self-care behaviors, increasing exercise, using relaxation techniques and medical checkups, managing the emotions. The research has shown that it reduces guilt and anger and depression that may come along with that role. And it increases the confidence and coping with the caregiver demands. And increased use of community resources are shared, so you know where you can find those. The weekly topics here are caring for you, identifying and reducing personal stressors. There's a 4-step process that participants go through. Communicating feelings, needs, and concerns. For example, using I messages over you messages. Communicating in challenging situations, and there's a couple of techniques there with some guidelines, including guidelines for communicating with persons who have memory impairment. And learning about our emotions, and mastering caregiver decision making, so tools for dealing with changes in making tough decisions. So this is an overview of the 6 evidence-based workshops that we have offered through the ADRC. And if you are interested in receiving more information or to register, there's a number of ways you can do that. You can do that online at our adrcevents.org, or you can call us. We have a couple of ways that you can reach us through a TTY line as well, or email. For all of these workshops, we make every effort to accommodate people with special needs. We have large print, we have ways to work with individuals. So whatever that might be, you let us know when you register. Advanced registration is suggested because some of these workshops fill up quickly.
Hello, my name is Emily Gilbertson and I'm the ADRC manager. I hope you got the information that you were looking for from our resource video. If not, or if you have more questions, we encourage you to call our office or stop by and set up an appointment. We also can meet with you right in your home. ADRC staff are available and excited to help you. Please contact us at the information provided to you on the screen.